in 6th grade, they said, well, you have to decide for 7th grade what classes you're going to take. My mother said, well, where are you going to be? And that'll help you to decide what class you want to take. And I said, well, I think I'm going to be a doctor. In medical school, I knew I was going to be a cardiologist because we started reading EKGs, and somehow I had a little knack for it or understood it a little bit. So then all the med students were bringing me their EKGs to look at and say, what do you think about this? And so I became the cardiologist in my medical school class. I think it's important to understand your patients and know them as a person. I think that you need to take something personal away from every patient that you have. Because I think then you can understand what motivates them and what makes them want to maybe stay with a treatment plan. I do have a ton of patients that I've seen for 20 years, and that's pretty gratifying to see I call my old timers, the people that I put a stent in 1995 and, still are doing well. And, I've had a couple of them that never made another blockage since 1995, and that's even more gratifying that we took care of them then, and they've done so well till now. They've had their families grow up. They've had their grandkids come along. My favorite thing to take care of is a heart attack patient because it seems like we make the most difference. We have patients coming in with a terrible blockage, having terrible symptoms, and really have a very lethal condition, and in minutes we can make them better. Before, we didn't have much to offer them, or we had limited offerings, even back to the days when I started. The treatments of balloons and stents and more non-invasive treatments have made treatments better, and people have gotten along better. More often than not, we get these arteries open, help people, and let them get back to their lives and what they need to do.